The Government Communication and Information System and the South African Depression and Anxiety Group are currently hosting a webinar on destigmatizing men's mental health. This comes at a time when South Africa is facing a heightened rate of mental health cases where mental health conditions and emotional turmoil experienced by many lead to an increased rate of suicide. Psychiatrist Dr. Fran Korb and clinical psychologist Zamo Mbele are unpacking the topic of men's mental health. Let's now take you back there.
Percent of people who goes onto an antidepressant will stop it within the first 3 months. So, and that is often what people say is that I stop the medicine, but then my depression comes back. And that is not addiction. That means you haven't treated your depression properly. So, all these, that's our whole other topic, staying on medicines, how to treat, how long to treat, how often to go back for help is another big topic. But in essence, that antidepressants really is not addictive.
Sure. Wow. I think a lot of people are guilty of that, actually. I mean, I know people around me as well who normally take them for 3 to 6 months and then they stop. So this was an eye for me. Yes. And then, Zamo, I just want to bring you in here quickly. I know we need to wrap up at exactly 11. Zamo, could you perhaps help with this question? Does depression in men present differently? And how is depression assessed in men versus women?
I mean, I think that it does oftentimes present differently. And if I'm going to say one of the most controversial things is that we really need to start to rewrite the textbooks that we use. Franz, I don't know how you feel, to teach a lot of our colleagues. So if you bear with me, I want to say the following, because a lot of the way that we speak about depression is correct, however, for a certain population. So, I mean, I speak, for example, for children, or I speak on topics on children, and I say a lot of people are missing anxieties or depression in children because the child is not expressing guilt, hopelessness, or is tearful, which are the three big, for example, criteria for depression. However, the child is not wanting to go to school, not wanting to play with the other kids, and does not have an appetite. And that we know, having worked with children, that the presentation is very different. I use that as a segue to say, and it's the very same thing in men and different men as well. For the longest time, the textbooks or the ways that we taught in psychology or in medicine actually was looking at depression in women in many ways. And that's why it looks as though more women struggle from depression than not. As opposed to we all struggle from it. The struggle looks different. And depression in men can oftentimes look atypical. And I'm going to rehash a lot of the points that I've already made. It looks like a lot of irritability and aggression. And if we have it in our society that irritability and aggression is okay for men, we're not going to see that that's a problem. It looks like a lot of substance abuse. Again, if we have it in society that boys will be boys and they will abuse substances, we're not going to see it as a problem. Sometimes it looks a little bit more functional, such as going to gym a lot or working incredibly long hours. And the working incredibly long hours, again, is hard to catch because the person is doing something that's productive and probably bringing in an income. So what it is doing is that it is allowing the person to isolate, not to be with others, which is a symptom, we know, of depression. So they may not be staying in their bedroom and closing the curtains, which is an important sign. However, they're doing the equivalent of that by staying at their desk and closing the door, not going to the water cooler, not going home to a family, so on and so forth. So in my bit of a ramble, I've tried to then say depression in men does look different, and we need to start knowing what it looks like so that we can help our fellow men.
Thank you so much for that, Zamo. Chris, okay. I just want to bring you in as well, as a man, what would you say to other men, who are not sure how to come to terms with their diagnosis or considering getting medical healthcare support?
So I would, with me, when I started getting help, it was way after I should have actually gone well. So what I would say to men in general is that go to a psychiatrist. I know a lot of institutions, like I took my friend to go and see a psychiatrist at a free clinic, but he had to make an appointment about 2 months in advance before he could get one. And by then, his life was already falling apart. Like what can he do? He didn't have the money to go to a private psychiatrist. Even with me, with my psychiatrist, I have to book about a month in advance to be able to go and see them. So I would say, don't wait for things to get bad, and go and see. It's always good to get a second pair of objective eyes to look over your life and your behavior and your decisions, because you may think that the aggression that you are exhibiting, or overworking out at the gym, you may think that it's normal because that's how it's been, but have someone look at your life, have someone to discuss what you're going through quite freely with an objective professional. And I would recommend that. And for someone who is coping with the diagnosis, the main thing is to be patient with yourself as well. It's not going to go away. It's not going to go away overnight, and you have to relearn a lot of behavior and relearn your ideas and your thinking about mitigation. Like you said, people go on for 3 months and then they leave it again. So it's to reevaluate your perception of so many things and ask a lot of questions when you're there. It's for your benefit. That's it.
Thank you, Chris. And then I'm just going to... Yes.
Musidi, can I just quickly just add a sentence there? I really want to support Chris there, but I also want to say that, please, if people notice any problems, depression, anxiety, any mental health issues, they must go and seek help. It's not, I know, we've only got about 400 to 500 active psychiatrists, state and private, in the whole of South Africa. So we are even much worse off than the psychologists. But there are other people. Phone the SADC helpline. Go and see your GP. Try and get an appointment with a psychiatrist. Try and get an appointment with a psychologist. And there are other groups, perhaps church groups. There are counselors. There are social workers. There are so many other things, other organizations where you can go for help. Please don't, if you phone a psychiatrist and they book 2 months in advance, just give up and say, I can't get help. The main message I want to get across is people need help. Please go to your GP. There you will be able to get an appointment within 2 or 3 days, or even the same day. So please go for help wherever you can. Don't just sit on it.
Yes, sorry. Just to weigh in, it's a very important point that Dr. Korb is bringing up there. I mean, I looked at every single resource that I could have. I had a friend who was training as a life coach, and he just got certified and he needed to go through the program with someone. So I went to him for assistance and to speak to things. I got involved in the church. I got involved with a lot of community organizations. I developed a training program as well that assists people in getting the help, or at least identifying that they need help. So absolutely, I 100% agree with that. Thank you.
Thank you for that, gentlemen. So I'm just going to give all of you the opportunity to just weigh in on the last comments before we close the session. But in your closing remarks, I would just like all of you to touch on where to from here. What do we need to take out of this session in helping us to destigmatize men's mental health?
Okay, perhaps I can start. First of all, thank you very much for organizing this webinar. And these are the kind of things I think that we need. The more we can talk about it, the more we will destigmatize. The more communities we can get involved, the more we will destigmatize. Mental health is just such a broad and wide topic that affects everybody. It's not only the patient or the husband or the man that suffers from depression. If he suffers from depression, his whole family suffers from depression. His marriage suffers from that. So it's one of those things that really goes out into to everything, into the community, into the families. So my main thing is that thank you very much for inviting us, and hopefully this is the beginning of many discussions throughout the whole of South Africa on lots of media platforms where we can just continue spreading the message of mental health and not only mental illness.
Thank you so much. And I must agree with Oli's comment there in the chat box that an hour can go by so quickly. Zamo, any closing remarks from you?
I just want to echo everything that Fran said, and I want to thank my co-panelists. Thank you, Franz, and thank you, Chris. Thank you, Mosidi, for hosting us. Also, really want to thank our team at SADC, the South African Depression and Anxiety Group. Thank you, Kyla, for making this happen, and everybody else at the office, and the volunteers that we have who are unpaid, who are picking up phone calls and trying to help the country. I mean, they really are the backbone of our structures. And then I also want to encourage everybody who has participated today, after saying thank you to everybody who's been here, encourage you to keep the conversation going. Keep the conversation going. And that's all.
Thank you so much, Zamo. Chris, quick closing remarks from you?
On my side, again, thank you to all parties involved for allowing me to share my story. I never shy away from letting people know that, you know what, it is possible to heal. It is possible to rebuild. And like my fellow panelists have also said, is that keep the conversation going. To talk about it in different ways, in different contexts, and spread the awareness, and also be there for people who you suspect may be suffering as well. Sometimes they just need someone to listen to. Thank you so much.
Thank you, Chris. Thank you, Dr. Korb, and thank you, Zamo, so much for the insight you've shared here. But also thank you to our participants who engaged with us through the chat box. We're not able to get through to all the questions, but I know that the team at GCIS, they always endeavor to respond to as many questions as they possibly can, and do contact them, as I've mentioned, if you'd like an interview outside of this session. This is where we leave it for today. But I think, as our panelists have shared, that let's keep the conversations going. Let's create a safe space for big boys to also cry when they don't feel strong enough. And let's know where to direct them as well for support. Thank you, everybody, and I wish you a wonderful day. Thank you.
All right, that's how that webinar ended, with studies having shown that depression amongst men looking very different from among women. And we've heard there earlier on clinical psychologist Zamo Mbele making the example of a man locking himself in a house with curtains closed, or even locking himself up in the office and not even go to the canteen or the water cooler as some of the telltale signs of depression. Well, psychologists can never overemphasize the importance of seeking help from peer groups, independent psychiatrists, or even the South African Depression and Anxiety Group. Psychiatrists there, Dr. Fran, Korb, and clinical psychologist Zamo Mbele, unpacking the topic of men's mental health, with guest speaker Chris de Brain sharing his own personal account of living with mental illness as a male. And this webinar serves to sensitize the public about the importance of mental health, and also, to explore the impact of toxic masculinity on the mental health of men, and to encourage men to open up and to seek necessary help.